Good morning, everyone. And just to say, first of all, thanks to the PSYCHED group for inviting me here to speak this morning on some research that we're conducting at UCC, and to thank Daniel for that very lengthy introduction. So just to say what I'm here to speak about today primarily is the Healthy Workplace Ireland report. Some of you may have heard of it. We launched it earlier in the year. But just to kind of give just to give an overview of what I'll speak about this morning, and I just keep an eye on time since we're over a little bit. Why study workplace mental health? Why is it something that I and my colleagues spent a lot of time working on? And obviously everybody in this room here today is very interested in it. I'll just talk briefly about the wider international project that I'm part of, and then spend most of the time talking about the Healthy Workplace Ireland report. So a little bit about study design and also key findings. And then very briefly, next steps. So as Daniel said, I'm an economist. I spend a lot of time researching firm performance, whether that's productivity, whether it's looking at innovation, understanding why some firms perform better than others in terms of the practices that they introduce in the firm, in terms of the technologies that they adopt. I've also looked at innovation in healthcare as well, and done some evaluations from a public sector perspective, so from the provider perspective. Mental health in the workplace is relatively a new area of research for me, but it's something that I'm finding really, really interesting and really important. And I think it's definitely very topical at the moment because people are very interested in it, and we're becoming more open about talking about mental health. So I suppose sometimes people think, well, mental health is a very personal thing, and why do we think about it in terms of the workplace? And I suppose it's becoming more widely acknowledged, and there's considerable research to show that employers do have a role in this area in terms of developing and implementing workplace cultures, practices, and interventions to support a healthy and a productive workforce. So the workplace is an important site of health promotion, and it requires inputs from the employers, from the employees, and also from society in general, because a workplace is part of a social system, essentially. Okay. We don't know that much about how poor mental health in the workplace affects productivity at a national level. We have this figure from a number of years ago that says that the annual productivity costs of poor mental health and well-being is estimated to be around 11 billion for Irish employers. But I'm just going to put a caveat on that because it is quite an old stat. In terms of working age adults, 15% are estimated by the World Health Organization to have a mental disorder. Okay, so this is something that employers then need to think about, and need to put practices in place to support people's mental health, because we know mental health is on a spectrum, and it can go from being very good to very poor, and employers need to be ready to deal with that. So what are the firm level impacts? So in terms of this particular study that I'm looking at, it's very much the private sector. And so firms are going to be interested in, well, why would I need to have good mental health practices in place? What's in it for me? Okay, other than the altruistic reason to have a happy and productive workforce. So absenteeism would be one of the firm level impacts that we look at, and this is when workers spend time off work when they're ill. Presenteeism then, which is relatively a new term, I guess. It's been used more frequently now, but this is when workers are at work when they're ill, okay? And we've all probably done that at some stage, but it is certainly more prevalent in some sectors and some firms than in others. And also staff turnover, so the need to replace workers who leave employment, either due to ill health or perhaps not happy with the culture in the place, and don't feel it's particularly supportive for them. So I suppose from an employer's point of view, it's so important to be proactive about mental health rather than reactive. And there are also calls to put psychological safety on the same footing as physical safety. So that's like part and parcel now of being an employer in terms of physical safety, but psychological safety is something that we need to think about as well. I think this quote captures quite nicely the area that I'm particularly working in at the moment. So from a public health perspective, the workplace is an important setting where actions can be taken to promote and protect mental health. However, most of the economic evidence in the workplace is focused on measures involving specific narrow measures, such as brief individual psychological interventions. So it's also important to look at the economic case for combinations of interventions rather than interventions in isolation, okay? So a lot of the literature will focus on one particular intervention in a workforce and measure it in terms of the impact it has. But that can be very much sector specific, it can be cultural specific. So this is what we're trying to, I suppose, provide more information and more data and analysis on as well. So the survey that I'll be presenting later, a lot of it, I'm looking at why firms implement mental health practices while others don't, and why do these variations differ across firms. So there is quite a large literature in this area. So there are positive motivations for implementing workplace practices, whether improved productivity, decreased absenteeism, presenteeism, and also that increased organisational commitment, so that loyalty to a firm that looks after you well. Okay, there can be barriers to adoption, and these are particularly difficult for small firms, okay, and they're kind of around lack of awareness. So sometimes the intention is there or the goodwill is there, but not sure how to implement good mental health supports. Financial resources is a huge issue for small firms and for lots of firms, particularly in the current climate, and also attitudinal barriers. So and we'll see that with some of the survey results as well. Some employers don't see it as their responsibility at all. And then, so some firms can decide to adopt particular practices, but the implementation then is key. So sometimes there's implementation barriers as well. So where there's a lack of management support, the socio-political context may be important there, organizational structures and resource limitations. So I guess I'm just putting those up there to acknowledge while there are very much strong motivations for implementing these types of practices, it's not necessarily easy. Okay, so just to very briefly mention this wider project that I'm working on. So it's mental health and wellbeing practices, outcomes and productivity, and it's a causal analysis. So this project is funded by the Economic and Social Research Council in the UK. We started in April 2022. And we received £1.9 million sterling to undertake this project. So it's a 3-year project. It's interdisciplinary. I'm one of the economists on board. We have a number of people from a management background and occupational psychology as well. University of Warwick is the lead on the project, and then we've colleagues from University of Nottingham, Lancaster, Queen's, and then myself in UCC. And I suppose just to say at this point, we're analysing data from the UK, from Ireland and from Sweden. As an economist, I suppose I'm primarily interested in the firm level data, so the firm performance data, but my colleagues in Nottingham and Belfast are looking at it from the employee level as well. And then some of my colleagues in Warwick are looking at implementing these practices from a team perspective and also from a line manager perspective. So we're trying to take in all the different perspectives and also all the important actors in terms of this type of organizational change. Okay, so to talk about the report then. So this data was collected between September and December 2022. So it's very recent data. And we published this report last year because we realized when we started working in this area that there's very little on what is being done in Irish workplaces in terms of mental health promotion. So there was huge interest in the survey, and when we were speaking to people in the area, there was a lot of interest. So we thought, well, let's publish the survey data even before we go on and to do the economic and the academic analysis on it and publish it in the academic arena. So it was 3 months. These were interviews conducted with 1,501 Irish employers with 10 or more employees. We believe it's a nationally representative sample, so we worked with our survey company quite closely to ensure that we had firms from all areas of Ireland, all sectors, all sizes, etc. And these were telephone interviews, and they took about 20 to 25 minutes each one. So we were delighted with the sample size and with the response rate, and there really was a willingness from Irish employers to engage with the process, which was fantastic. So do Irish employers agree they have a responsibility to workplace mental health? Well, in terms of our particular sample of 1,501 employers, 76% agree that they do, whereas almost a quarter don't think that they have a responsibility to mental health. Okay, so these are going to be, I suppose, the laggards or the late adopters in terms of any of this mental health promotion within the workplace. But there are differences in terms of the type of firms, in terms of the responsibility to workplace mental health. Larger firms are more likely to acknowledge that they have that responsibility, and it's a smaller proportion then for smaller firms. We also saw some attitudinal differences across sectors, so construction, wholesale and retail were more likely to strongly disagree. So those sectors were more likely to say that they didn't have a responsibility to workplace mental health. But I suppose from our point of view, 3/4 saying that they do have a responsibility is really quite positive. So then looking at the workplace mental health and wellbeing supports that are in place in Irish firms. And these are just some of the practices that we looked at, but they are, I suppose, the more kind of formalized practices. So there can be practices in firms where there's encouragement of open conversations around mental health or disclosure of mental health issues, but these are kind of very much kind of more formalized practices that would be in place. So in terms of having a health and wellbeing lead, so this is somebody on the board or in senior management, about 1 in 3 firms said that they do have a health and wellbeing lead. In terms of offering in-house support or signposting of services, 29% of firms said that they had that in place. Okay. In terms of having a mental health plan, a little less than 1/4 of firms have that in place. And monitoring mental health and well-being, again, about 22% of firms said that they do that. In terms of mental health champions, and this is something that we're finding is really very effective in terms of promoting mental health in the workplace. Only 1 in 10 firms said that they had mental health champions. Okay, so in terms of those stats, if we think about them in terms of firm size, well, that matters. Larger businesses are more likely to have these practices in place. So for example, in-house mental health support and signposting of services, 57% of larger firms do have that in place, whereas 20% of smaller firms, so that would be firms with 10 to 19 employees, have it in place. And I suppose one of the things that this finding isn't particularly surprising, and it's probably because a lot of the larger firms have a HR function. So smaller firms may not have that function in place, and mental health and well-being often falls under the remit of HR. So again, it's more difficult for smaller firms that are both resource and time constrained in terms of implementing these kind of practices. The mental health and well-being lead, as I said, it was the most widely adopted practice. You're more likely to have that in business services and the hospitality sector as well. Again, firms in wholesale retail are least likely to adopt those practices, so having a mental health and well-being lead and the other practices as well. Okay, so are employers investing in workplace mental health? And this was a very specific question that we asked. If they had a dedicated mental health budget, and only 1 in 5 employers said that they had. Now, it's probably important to acknowledge it may be a case of some of that is coming under different budget lines, like training or HR, etc. But in terms of having a budget specifically for mental health practices and promotion, 1 in 5. And again, we see that increase with size. Okay, so the larger firms are more likely to have that budget, 42% of firms with 50 plus employees. Again, we see some sectoral differences here as well. So in terms of the budget, business services, other services as well are more likely to have that budget. Construction, wholesale and retail, less likely to have a budget for mental health. So when we spoke to employers about mental health absenteeism, what became very apparent is that it is a growing challenge for employers. So when we asked them if they had staff or workers who had a sickness absence due to mental health reasons in the last 12 months, 18% of all firms said they did. And again, this was much higher for larger firms. 40% of firms with 50 plus employees said that they had experienced mental health absenteeism. And I think it's probably important to caveat this here is that there will be workers who will be out on sick leave due to mental health issues, and they don't disclose that for various reasons. So I think that figure is likely to be larger than firms even realise themselves. In terms of would firms think that they've seen an increase in mental health absenteeism, 53% of firms said that they had, and a very small number, 6%, only saw a decrease, with 40% saying no change. So 1 in 2 firms feeling that this is a growing problem for them, that they're seeing more mental health absenteeism. It's important as well to think about how the impact of absenteeism impacts business performance, and this is something that we're looking at with our with the other strands of this project. So how teams are affected if one person is out for mental health absenteeism, or also if you have somebody experiencing a mental health problem and they're staying within a team and continuing to work, that can have repercussions for everyone on the team and their performance also. So things that our employers said, well, the ability to finish critical high standard projects on time was a problem where there was absenteeism. It puts more pressure on the remaining staff, and the workload builds up to be picked up when they come back. So for some people, they might take some time off for mental health related reasons, but when they come back, it's all sitting there waiting for them. Some employers spoke of a lack of interest in the work. They get agitated, maybe not getting along with colleagues, not completing tasks, and very little work done at the end of the day. leaving workplaces short-staffed, that came up again and again, that this was something that was of concern to employers. And also the cost of replacement staff. So, you know, particularly in areas like childcare, where you have to bring in somebody if you're going to keep the service open. So presenteeism then, so working when ill. 27% of firms in Ireland report that they experience presenteeism, or they have staff presenting for work when they're not well. Again, this increases with firm size, and there are sectorial differences as well. So you're more likely to see this in business services and other services, and less likely in hospitality. And I think presenteeism is something that we need to consider in this new way we have of working now, in terms of hybrid working and people working from home more. Well, maybe it's easier to engage in presenteeism when you're working from home, you know, rather than when you have to go in. So this is something that we need to consider as well. Why employers think presenteeism occurs. For Irish employers, the two most commonly cited reasons were the need to meet deadlines and also client demands, so having to finish something by a certain time. Very quickly, I'm going to talk a little bit about how our data for Ireland compares to data from England. So the data from England here was collected in the early part of 2022, and the Irish data in the later part of 2022. So just to bear that in mind a little bit in terms of the timeline and the COVID timeline there of the pandemic. We were further along when the Irish data was collected. Mental health sickness absence is lower in Ireland than in England, and that's irrespective of firm size or sector. So mental health absenteeism is lower. We do have more presenteeism in Irish firms than in English firms during the same time period. And fewer Irish employers engage in mental health and wellbeing initiatives than their English counterparts. So just in terms of the graph there, the grey is Ireland and the white is England. And you can see that the proportions of firms adopting these practices is much higher across all of them for the English firms that we surveyed. Just one of the final slides talking about the changing nature of Irish workplaces, and this is something I think we're all very familiar with. So prior to the pandemic, only 7% of firms in Ireland had employees who worked from home. This has increased to 1 in 3. So of the firms that we surveyed, 32% said that they had employees that worked from home. And in firms where they had 50 plus employees, that figure rises to 50%. 64% then of business services firms are most likely to have employees that work from home. So again, very much the nature of the employment will dictate whether employees can work from home. So they were some of the major changes that we're seeing in Irish workplaces, and we were able to document as well. When we asked employers about their attitudes to having employees work from home, only 17% of them considered staff to be working remotely as being less productive than those in the workplace. So that's quite positive, I think, and I think that is something that we wouldn't have seen if it had not been for the COVID pandemic and employers became more familiar with having employees working from home. Probably the greatest challenge that employers mentioned within the survey in terms of having staff who work from home was very much teamwork, so getting people together working in teams. So they thought that was the main area that they would be concerned about. Okay, so I think I'm doing okay time-wise. So just to very briefly say that in terms of the next step, so the survey, we've collected it. I have some copies if anyone would like one as well. We've collected the data, and now we're working on this data and data from the UK and data from Sweden. And just to say with the UK data, because this study that I'm involved in now is building on a previous one, we have already 4 waves of annual data from the UK employers, starting from just before the pandemic and every year since then. So it's a fantastic data source to be able to work with and see the changes over time. But in terms of my particular work packages on this project, and in terms of what I'm investigating, well, I'm looking at the link between productivity and uptake of mental health practices at firm level. So is it a case of the more productive firms that there's a higher cost to them of having mental health absenteeism? And are they more likely to implement mental health practices because of that? So that's one of the papers that we're working on. And then we're also looking at, well, do firms that implement these types of practices, do they see a benefit in terms of productivity outcomes? So we're looking at that causal relationship because we want to see how employers can support better mental health and well-being, but at the same time, from the employer perspective, they want to see that boost in productivity as well. So we want to see whether these practices can do that. I suppose we know from other work that we do, particularly in terms of technology adoption, that the benefits of introducing new practices may not be felt in the short term, and that there is, it takes time for practices to be implemented and to be embedded within the culture. If I may, I just want to mention another part of the study that we're working on at the moment. And this is from the employee perspective. So we're looking at the link from employee mental health and productivity. It would involve, if there's any employers in the workplace who would be interested in this study, it would involve sending a short survey to all employees in your organisation. And what we will give you from that is a tailored, anonymised organisational report on your employee engagement and well-being. And also there will be training from some of the senior leadership team in the group to tackle HR challenges surrounding employee well-being. So if anybody is interested in that, it's currently in the field, and we're going to be collecting data up to the end of next month. So if you're interested, the QR code is there, or also you can always contact me by email. So jane.bourke@ucc.ie. Okay, so that's me, John, I think. Thank you very much. I'm very happy to take questions whenever Daniel says now, or during the panel discussion, or over coffee as well. Yeah.